What if the science behind a new White House health warning was actually just a rejected court testimony from a paid expert witness? The Trump administration is now officially advising pregnant women against using Tylenol, citing a new study that links the common pain reliever to autism. Today, we are going to follow the money and expose the deeply troubling story behind the Harvard academic they are using to justify this national health policy, because this goes way beyond one study. This is a story about how easily misinformation can be laundered into official government policy using a scientist whose work a federal judge had already thrown out of court for being unreliable and misleading. This is a manufactured crisis with very real consequences. But before we unpack all of that, if you want to be part of this conversation, make sure you are subscribed and let me know your initial thoughts in the comments below. It is the best way to support independent content like this. Now, let us set the stage for this whole mess. So, Donald Trump has nominated Robert F. Kennedy Jr. to be the next U.S. Health Secretary. And this is not a surprise to anyone who has been paying attention, a move that has many in the medical community deeply concerned, and for very good reason. RFK Jr. has built a career on promoting misinformation. He is the person who has relentlessly pushed the scientifically demolished lie that vaccines cause autism, a claim based on a fraudulent study from 1998 that was retracted years ago. He has promoted conspiracy theories that 5G technology is used for mind control, that antidepressants cause mass shootings, and that fluoride in drinking water is a dangerous plot. This is the person the Orange Menace wants in charge of the health of the nation. This administration has already shown its hand. Just recently, they were pushing a drug called leucovorin as some kind of exciting treatment for autism. The science on that is, to put it mildly, not settled. Many top experts say it is incredibly premature and that there simply is not enough safety data for it to be used as widely as the administration plans. But that is the pattern, is it not? Find a fringe idea, ignore the warnings from the mainstream scientific community, and present it to the public as a breakthrough. It is governing by chaos. Which brings us to this week, and the biggest, most reckless claim of them all. On Monday, the administration held a press conference to officially advise pregnant women against taking Tylenol, one of the most widely used pain relievers in the world, linking it to autism. They created a wave of panic and fear for expecting parents everywhere. But where did they get this information? On what solid, peer-reviewed science did they base this terrifying announcement? Well, this brings us to the grand finale, the punchline to this entire sick joke. Let us pull up this incredible piece from the Times, because it exposes the whole thing as a complete sham. Look at this headline, just let it sink in. It says, scientist behind Trump Tylenol claims was paid $150,000 to give evidence against drug maker. Paid $150,000. The so-called expert at the heart of the claim from the White House was a hired gun in a lawsuit against the makers of Tylenol. And if you think that is bad, get this key quote from the article. According to a court deposition in August 2023, Baccarelli said he had made about $150,000 as an expert witness in the case. So let us be perfectly clear. The administration based its alarming public health guidance on a study co-authored by a man who was paid a huge sum of money to push this exact narrative for a lawsuit. Is that not a massive conflict of interest? Does that not immediately raise serious questions about bias? But wait, it gets so much worse. What did the court think of this expert testimony he was paid so handsomely for? Well, the judge did not hold back. In December 2023, their testimonies were dismissed by a federal judge, Denise Cote, who found their views to be unreliable. The core evidence was already reviewed by a federal judge and thrown out. The court found it was not credible. And yet, the administration, the people in charge of public health, picked it up, dusted it off, and presented it to the American people as fact. This is unbelievable. The judge went even further in her takedown of this so-called expert of Baccarelli testimony. Cote said, the discussion in his reports is incomplete, unbalanced, and at times misleading. Incomplete, unbalanced, and misleading. That is the official legal finding on the work of the scientists behind this national health scare. And what does the broader scientific community think? Are they all on board? Of course not. Here is what another expert told the Times about the research. The statements in the discussion suggesting that the link is strong, rather than somewhat equivocal, combined with the unorthodox methods, raise serious concerns about bias. Are you seeing the picture here? This entire crisis was manufactured. They took a paid expert, whose testimony was already dismissed by a judge as unreliable and misleading, and whose methods raised serious concerns about bias, and they used his work to scare millions of people. This is not just a mistake. This is a deliberate act of deception. This was never about public health. It was a political performance from Trump, designed to create chaos and validate the fringe views of his chosen health secretary. They wasted everyone's time. They wasted taxpayer money. And they inflicted untold amounts of stress and fear on vulnerable people, all for a talking point. All they did was prove, beyond any doubt, that they simply have no idea how to govern. Truth never rests defiance till the end.